Welcome to the Birds and the Bees podcast. This is Braxton Dutson.
That's the key. People aren't talking about it.
Everybody needs to know that porn is not a documentary.
It's not like if we don't talk to kids about sex and sexuality, they're not going to hear about it. They're just not going to hear about it from us.
They have tons of questions, they just don't know how to ask them.
All you have to do is be one chapter ahead. You don't have to know everything. Just one chapter ahead of wherever your child is.
Do you have painful periods? How about irregular periods? Have you taken birth control to regulate your period? Are you a partner of someone who's experienced issues with periods? Hey everybody, this is Braxton Dutson, and welcome to Birds and Bees podcast. I'm so glad to have you hive mates with me once again, and if this is your first time, welcome to the show. If you're a longtime listener, thank you for your continued support. I am excited to bring you this episode today, because I'm with Lara Briden. She's on the show with me today, and she has over 25 years of experience working with women and issues dealing with menstruation. She's followed the cutting-edge research dealing with periods, and she's on the show today to give us a sneak peek into her upcoming presentation called Ovulation Matters at the Rocky Mountain Sex Summit on November 16th, 2019. In this episode, we talk about the evidence in research that has been coming out recently, some common misconceptions, issues with hormonal birth control, what actions you can take with nutrition to address some of these common symptoms with issues in periods, and the topics she'll be covering at the Rocky Mountain Sex Summit. This is such an important topic because in 2018, the World Census stated that there's 3.7 billion people in the world who are female-bodied individuals. And we know that almost all of them are going to experience menstruation. It's such a common experience that has historically been under-researched, and many women suffer from PCOS, endometriosis, irregular and painful periods, and it doesn't have to be that way. The research coming out nowadays is stating that there's other things that we can do. So frequently, we're told that it's normal to just suffer through it. It's a thing that women are supposed to go through. But Laura's here to share the news that it doesn't need to be that way, and that it doesn't have to be something you suffer through. This episode is brought to you by the Rocky Mountain Sex Summit. If you'd like to attend the summit, visit rockymountainsexsummit.com to register. It comes with continuing education units for therapists, and if you don't need continuing education units for ASECT or for NASW, you can sign up for a cheaper price just to attend the summit. If you find this episode supportive, I encourage you to think of someone who could use this, especially because we're looking at half the world is female-bodied and probably experiencing periods. We're all growing together in these discussions, and you sharing this may be the support that they need to start some really important changes in their life. If you have any questions, please feel free to give me a voicemail, 385-449-1818, or email me at birdsandbeespodcast@gmail.com. Once again, thank you so much for listening. I appreciate you being a part of the Hive. I love you all so much, and I'm so excited to get you this information today from Lara Briden. Let's get right to the show. All right, welcome to Birds and Bees podcast. This is Braxton Dutson, and today we have a special guest. This is Lara Briden is going to be with us today, and this is in part with the Rocky Mountain Sex Summit. This episode comes to you in part with Rocky Mountain Sex Summit, and I'm really excited to talk about what we're going to be exploring today, which is periods and some of the different misconceptions that come up. And I mean, it's something that is, gosh, in the background of people's minds, and then also if you're a female-bodied person, that is something that you're dealing with or have had to deal with in life. And Lara has given so much of her time to be able to learn and explore just how to help better manage this and bring this to the forefront of the discussion. So I'm excited to talk with her about this today. And one of the things that I love about her kind of a title that she has. She's the title that has been, when I was introduced to her, she was explained to me as the women's health doctor and period revolutionary. So welcome to the show, Lara. I'm so excited to have you here.
Hi, Braxton. Thank you for having me.
Tell me a little bit about yourself, like how you got to be the women's health doctor and period revolutionary.
Okay, I started as a biologist.
As a biologist?
A few decades ago. Yes, I trained at the University of Calgary in Alberta as an evolutionary biologist and ecology degree. And I did some research there. I even published a scientific paper on sex differences in foraging behavior of bats, just for what it's worth.
Wow.
I'm sharing that. So I've been interested in, female-bodied animals for a long time and how we work and how we function. And from that place through the lens of biology and understanding how the human body works. I went on to do my degree of naturopathic medicine from the Canadian College of Naturopathic Medicine in Toronto, Canada.
Wow.
So that gave me the qualification of naturopathic doctor, and that was more than 20 years ago. And since then, I've pretty much been in full-time practice helping people, and specifically helping women to have better periods, easier periods. I found early on that period problems respond incredibly well to simple diet changes and nutritional supplements, even better than I was taught to expect. So
wow.
I worked with that for a couple decades. And then about 3 or 4 years ago, I put all of that knowledge together into a book called Period Repair Manual, which has reached a lot of women. I'm really excited about how many women that book has helped.
Yeah, I'm excited to talk about that book today too. Like as we explore more of this and what your experience has been. Yeah, that book, it sounds as though that's also going to be available here in Salt Lake when you come out.
The conference organizers have purchased a book to give to the first 75 people who bought a ticket. So that's great. They get a part of their entrance fee. Yeah.
That's exciting. So as we start talking about this, I am curious about what, well, first off, we're talking about periods. This is a part of life. And often we use slang such as, that time of the month or Aunt Flo or whatever it may be. There's so many from across the world that I've heard that kind of allow us to maybe avoid the discussion about periods and menstruation. So I'm curious, what are some of the misconceptions that you that you've heard the most that you want to address?
Okay, I guess I really want to start with this right off the bat, because this is kind of an important part of my book, which is that pill bleeds are not periods. So the bleeds we have on contraceptive drugs or on oral contraceptive pill is not a real period. And that has, in the sense that a real period, as I'm going to be explaining at the summit, is what's called an ovulatory cycle. It's an event with the ovaries where ovulation is the main event. It takes about approximately a month for the ovaries 2 weeks to travel to ovulation, and then 2 weeks after ovulation, and that's how women make hormones, and that's the whole anatomy of a menstrual cycle. That's what it's about. Mm-hmm. The pill works, of course, by shutting down ovarian function.
Yeah, kind of a trick.
Completely. It shuts it all down.
It shuts it all down.
Induces almost like a state that's more akin to kind of a temporary reversible menopause. Like if you try to measure hormones of women who are on the pill, they don't have any. The hormones are coming down, coming out at very low levels. And then with the pill, you get a drug-induced bleed, which is just a false reassurance that something has happened. There's actually no reason to bleed monthly on hormonal birth control. So
no kidding.
This is one of my key messages. It's not the only. Obviously, the book is about how to have healthy, natural periods, but I think it's important from the outset just to establish I'm talking about natural menstrual cycles as something important for women's health. That's the topic. That's the title of my presentation. I think it's something like the value of ovulatory cycles or natural menstrual cycles for the general health of women and girls. Mm-hmm. It's how we make hormones. It's actually a pretty big deal because our hormones, female hormones, estrogen and progesterone, are just as important for our health as testosterone is for men's general health. It's not something we should just be turning off routinely.
Gotcha. So it'd be kind of, if maybe it's not the best to compare in this way, but it'd be like saying, men, we experience something this way, so let's just kind of shut off that testosterone side of you and you live your life.
That's exactly how it would be. Here's an analogy I often give because of the way contraceptive drugs are used so routinely. And I'm not saying that the pill has no purpose or no, obviously it has many benefits as well, but just philosophically, just to take a step back and look at what we're doing, to say that it's okay to routinely switch off the ovarian function of millions of women and girls and to say to them basically, look, you don't need your hormones, your estrogen and progesterone until you're ready to make a baby would be like saying to men, you don't need your testosterone until you're ready to make a baby. Whoa. Which would be crazy, obviously. But, as women, we benefit from those hormones. That's one of my key messages. I get very passionate about it. So I hope some of your listeners are coming along.
Yes. I hope that everyone comes to see you as well, because it's not just for clinicians. Historically, some of the Rocky Mountain Sex Summit has been aimed towards clinicians, but this is for everybody,
I think it's a mix. I think it's going to be, clinicians, their practitioners, and also some just members of the public, which would be great. So my presentation should be suitable for everyone. It's a little bit more technical information for those people who need it. And
yeah, definitely. So as we're talking about this, and first off, you're coming from New Zealand. So
yeah.
This isn't like you're coming from one state or, up in Canada. You're coming across the world to share this message.
I literally am coming all the way from New Zealand to Salt Lake to do this event.
You're coming from spring to winter. We are snowing right here.
Yeah, I live in I'm Canadian. You can probably tell from my accent, but I live in Christchurch, New Zealand. That's where I am speaking to you today. It's a spring morning here today. I won't say lovely spring morning, kind of half cloudy spring morning, but yes, getting on a plane in a couple of weeks and flying over there.
Yeah, excited to have you. When it comes to this passion, I can feel the passion that you have when we're talking about nutrition, and as well as knowing that, okay, these hormones are so important for our bodies, and that routinely shutting them down is not the greatest. What are some of the, as we talk about these misconceptions, what are some of the ways that people, or that you encourage people to start rethinking maybe nutrition?
Actually, first I want to answer just another question that you didn't exactly ask, but I sort of feel like I want to jump in here because this idea that, okay, it's not good for girls or women to shut down these hormones routinely. What is the evidence for that? Is there evidence for that? And I actually want to share a couple of those recent studies because the evidence is building. And if I'm honest, the evidence is a little disturbing. So for example, just something very simple, there's been a couple of studies. One was done by a Canadian endocrinologist who's a colleague of mine who helped me with my book. Her name is Professor Geraldine Pryor, and she's also really worth, she's published dozens of scientific papers about women's hormones. And one of her recent ones was about the impact of the pill on the health of bones in young women, something called bone density. So we are both men and women, actually, as we move through our teenage years and into our 20s, we're building bone. That's when we're laying down bone and reaching what's called peak bone density, which is the strongest bones we're ever going to have. And that's like money in the bank in terms of what's called metabolic reserve. That's going to hold us for the rest of our lives. We've still got many decades to live after that, and bones will slowly decline in strength from that point. So it's actually quite an important thing for young people to build bones appropriately. So there's been some suggestion for a while that young women on the pill don't do that. And recently, Professor Pryor published a study where she found not only are girls on the pill not reaching peak bone density, but they're losing bone. They're going backwards when they're supposed to be going forwards. And the explanation is very simple. It's just they're not making the hormones, both estrogen and progesterone, which are beneficial for bone health. Instead, they're taking contraceptive drugs, which, to be fair, do have some similarities to estrogen and progesterone, but they're not the same molecules. And we can see now in the effects on the body that substituting those contraceptive drugs for real hormones has an impact on bones and also on mood. I want to mention this because myself as a clinician, I think what motivated me to write my book more than anything was young women struggling, seeing my patients struggling with depression and anxiety that seemed to me to have started when they started contraceptive drugs, particularly the pill, but also some of the other methods, injection and implants can cause that. And we know that from some big research that came out of Denmark a few years ago, tracking 1.1 million women and linking contraceptive drugs with depression. Wow. And then more recently, another Canadian study, not by Professor Pryor, but by another group of researchers, did an interesting study where they were able to estimate, so that basically what they concluded is that it was a small sample size, but still it's a preliminary finding that women who took the pill as a teenager potentially go on to have a 3 times higher risk of depression later in their life, even years after they stop the pill. And what they say basically is that during puberty, the brain is changing. We know that. And the brain is rapidly changing during puberty. It's very sensitive to hormones or hormone-like drugs. And so being on those drugs during such a vulnerable time potentially can change a woman's brain forever.
Holy
So,
cow.
I mean, this is not a small thing. You can see why I'm passionate about it.
Yeah.
This is affecting a lot of people in a pretty big way. And so, yes, of course. So we're going to, including in our interview, we're going to offer alternatives to the pill, because I can't sort of have this whole conversation and then just
stop. It's like, guess what?
And then just stop and say, well, you're on your own. Sorry. So, yeah.
Wow. So this is, it sounds as though we're on the verge of kind of, this is the cutting edge research of the hormone birth control.
We're on the cutting edge of a paradigm shift, I think.
It sounds
we've
like
just
it.
We've come out of 60 years, about 50 or 60 years, thinking it's okay to use contraceptive drugs very routinely. Mm-hmm. And I think that house of cards is going to, fall at some point, because
holy cow.
From directions, there's evidence from many directions just pointing to, there have to be better ways, starting with, let's just begin with, tying back to your question about what can we do with diet. And for example, so of all the women who take the pill, about 1 in 3 take it to so-called, in quotation marks,
yes.
I'm making quotes, regulate their period.
To regulate.
Which I just explained it can't do. It could never do that. Mm-hmm. Of course, some women are taking the pill to prevent pregnancy, which is a different situation. Some women are taking the pill to suppress symptoms of pain or heavy bleeding, which is sort of a separate topic, which we may not get to today, but I am going to cover at the summit. But I will just, on the topic of irregular periods, and having established that the pill cannot fix that problem, so then we're left with the issue of what can we do for these young women who are having either no periods or irregular periods. Mm-hmm. And obviously it is beneficial for health to have regular periods, real periods. So it should be on every doctor's radar to find a way to help young women to do that. Chapter 7 in Period Repair Manual is all about that.
Mm-hmm. So what I'm understanding, real quick, please. When if I'm understanding it correctly, it is not regulating a period because it is, it's the pseudo period. It's just bleeding. It's just telling the body to do this. It's tricky.
It's a drug withdrawal induced bleed.
Arbitrarily
dosed to 28, 30 days because of the dosing on the box, basically. Like, it's nothing. You could have a drug induced bleed, withdrawal bleed, anytime. I mean, there's a reason to do it monthly. It doesn't mean anything.
Doesn't mean anything.
No, and remember, the ovarian function is shut down.
Yeah.
So there's no cycle.
There's no cycle that's happening. It's not releasing any egg. It's not, it's shutting it all down. And then we've just got this almost psychological, okay, well, I'm bleeding. I'm having my period, and it happens every 20 to 28 days. So therefore it's regulated. And that's not what's happening.
Yeah. No, I mean, if you look into the history of it, we won't go into all of that now, but it was a marketing. It was this monthly bleed on contraceptive drugs it was put in place to persuade certain groups that this was, natural and not. So it had sort of political and marketing reasons. And at the time, back in the 50s and 60s, those doctors didn't think it was anything. Mm-hmm. But I mean, now 50, 60 years on, we're under this very strange, almost emperor's new clothes situation of thinking, on the one hand being said it can use to regulate periods, and then lots of people, including myself, saying, well, it can't. It never could.
Wow.
So it's big. It's important. You can see why I'm traveling all the way from New Zealand.
Yes.
To talk to you guys about this.
Yes.
And so let's just say there are ways to regulate the period. The body wants to have regular periods. This is where my training as a biologist comes through. I mean, this is what the body wants to do. And I think my experience is when the body is given half a chance to do it and ovulate regularly, then it will do that. So just working through a quick little troubleshooting, flow chart. I'll just work through it very quickly. I mean, step 1 is see the doctor, to say to the doctor, ask the doctor, why am I not having periods? And the doctor does need to do various investigations and troubleshooting. And this, obviously, at the very beginning of that process, there's several possibilities, which we won't go into all of those now. At the end of the day, it's often one of two things, which is, just to boil it down, it's usually especially when young women, so when I say young, like in their 20s, lose their periods, it's usually one of two things. It's either undereating, which I'm going to speak about a lot at the summit, versus something called polycystic ovary syndrome, which is actually nothing to do with cysts on the ovaries, which is kind of confusing.
That blew my mind when I read that in your blog. I was like, polycystic has nothing to do with cysts.
Correct.
PCOS is not what I thought it was. Holy cow.
Yeah, but PCOS, that said, PCOS is real. It's a hormonal condition for women, of having excess androgens or male type hormones, testosterone or other androgens. It's it's normal for us to have some, but it's not good for us to have a higher than normal amount. And that can impair ovulation and also cause symptoms like weight gain and facial hair. It's definitely a condition that requires help. So now, as I'm going to be describing in my presentation, what's important to understand is actually quite a bit of, in terms of symptomology, there's quite a bit of overlap between losing your period to undereating and losing your period to PCOS. They can look quite similar, and undereating is often misdiagnosed as PCOS. So it's very important to get that diagnosis right. And I hope every clinician who's in the audience will come away feeling very confident to get that diagnosis right between those two. Because just in a nutshell, in terms of treatment, obviously the treatment, if you lose your period to undereating, the treatment is to eat more, but in some cases a lot more, including carbohydrates. And the low carb craze for young women has caused some young women to lose their periods. I'm not anti-low carb, but I'm just saying when for a 25-year-old woman who's lost her period doing that, that's a problem. She needs more carbs. So the treatment for undereating is eat more. The treatment for PCOS is often to eat less. Depending on the type of PCOS, it's to eat less. So you can see why it's quite important to get that difference correct to make that diagnosis. Do you eat more or do you eat less to get your period back?
Yes.
So we'll be going into that in some detail. There are also some supplements that work very well for PCOS. I'll mention one by name because we're in this territory now where a nutritional supplement that just a few years ago was quite considered maybe alternative medicine, is now fully in the territory of evidence-based medicine. It's a supplement called inositol. It feels like I'm doing an advertisement for it, but I'm not.
Is there any affiliation? Because I'm not getting paid for this.
No, there's no I don't own any of it. I don't sell inositol in any way, shape, or form.
How do you spell that? Inositol?
INOSITOL. I'll give the details. And the great thing about it, I do feel like I'm doing an infomercial. It's not expensive. Any brand is fine. But anyway, the point being, it was included in a very prestigious set of guidelines called the International PCOS Guidelines, which are the recommendations for treatment for specialists and doctors around the world for PCOS. And inositol was included in that, which was really exciting, which means it's gone through all the hoops of having randomized controlled trials and meta-analyses, and it's been determined to be effective for PCOS. So that's just an example of something, just to, after I spent the first half of our interview saying how the pill can't help regulate cycles, now I'm offering there are other ways that can help to regulate cycles.
Wow. So even just having some...
Have your own periods. Yeah.
To be able to change that in that way through the, and you're going to be covering even more of this in the, in your presentation.
Yeah. I'll be offering a little bit. I mean, I want to cover quite a few topics, so I'm not going to spend too much time on PCOS, but I'm definitely going to mention it.
Oh, definitely.
And that differentiating between undereating or what's called hypothalamic amenorrhea and PCOS is quite an important thing for anyone who is a woman or works with women or gives advice to women or knows women, even just for members of the audience who just know a young woman, that might be enough for them to be able to help.
Yeah. And that's what we're looking for. Again, this is for everybody for that,
absolutely.
That purpose in of itself is that someone that is a young woman, is a woman that, that could use this information.
Exactly. Yeah.
So in knowing a little bit more about, at least even with what you've just told us, they can go to their doctor, they can say, what do you know about this? And even take this information you've just said and say, okay, well, gauge how much your provider knows about PCOS, and if it's just this all-encumbersome one, or if they know that there's 4 different types of PCOS and how to start addressing that.
Yeah. So in Period Repair Manual, I do include a section of how to speak to your doctor to encourage that kind of dialogue.
Mm-hmm.
So they're just simple questions like, just things like saying to the doctor, okay, my understanding is that I'm not ovulating regularly. So have we looked at why that is? Kind of targeted questions, and all in language that the doctor can relate to and feel comfortable with, and build bridges. And I guess my goal is, especially if a woman has decided she does want to try to have regular natural menstrual cycles for the benefits of her making her own hormones, then she can go to her doctor without just coming away with another prescription for the pill. Because this is obviously one of the problems. Even the most well-meaning doctor, sometimes if they don't have another solution, they might just say, well, this is a tried and true, the pill is what we prescribe in these situations. So they're kind of, I guess the way I say it often, they're often using one of the only tools they have on their tool belt to deal with some period problems. But I'm offering, with my work, and a lot of it, as you've mentioned, is free on my blog. So I'm offering a lot of what I hope are additional tools for everybody to help women to have easier, better periods, natural periods.
Definitely. So with parents that want to support maybe they've got a daughter that is just about to, or that is starting to experience irregular periods, or they're worried about her menstruation. So they're worried about her cycle. And they're also sitting here thinking, oh my gosh, well, we were going to put her on the pill and now we don't necessarily want to. What I'm hearing is that this book can also really help that language as well. You just take the language from me into what's going on with my daughter. If you looked into what's happening here, is there any suggestions you'd give us as parents? To do that. Yeah,
I guess I might just speak directly to parents who are listening right now. I'll just run through. So we've spoken about irregular periods, and just pointing out, it should be obvious, but I'll just say it. It's pretty normal for girls to have teenagers to have irregular periods for a few years. So you don't want to overtreat in that situation. You need to. She's maturing her hormonal system.
So as it's firing up, it's going to have these ups and downs and irregular. It's not going to start.
No, it's not going to just go like that, like a metronome right from the beginning. It's exactly, the whole system's firing up. It actually, according to Professor Pryor, who's a Canadian endocrinologist who helped me with my book, and this quote is in the book, it takes a young woman or girl 12 years to mature her menstrual cycle. That doesn't mean she's going to have 12 years of irregular periods, but essentially 12 years to be fully what Professor Pryor calls robust in terms of regular ovulation and making enough progesterone, and it's all happening. So that's quite a long time. I mean, when you're thinking about, girls needing that opportunity to mature their menstrual cycle. So as I said, there are options for irregular periods. Irregular periods are usually quite easy to fix, I'll say, for what it's worth. And it's important to have the doctor come on board for the diagnostic part of it and rule out other more rare concerns. Then, just quickly, like two other problems that teenagers face. One is skin, which is really worth mentioning because I can't tell you how many young, and fair enough, it's upsetting. I can understand that for anyone, especially for a teenage girl, to be dealing with problem skin.
Oh yeah.
So we don't want to just dismiss that. I guess the solutions. I'm just going to just share the solutions I do with all of my patients. I mean, this is in my book, and obviously there's going to be different situations slightly for different people, but it's not complicated. This is one of my key messages. It's not complicated. Usually teenage acne responds incredibly well to a combination of temporarily, or at least, if you're trying for a few months or a few years, removing from the diet high dose sugar. So that's dessert type things, right? Like pop and soft drinks and
oh man, it would be that. It would be that.
Yeah. And so I don't mean by sugar, I definitely don't mean fruit. Like they can totally have fruit, they can have, but the amount of sugar that a lot of us eat now is beyond what the body can handle hormonally. And that is a major driver of skin, especially at any age, especially in teenagers. So that's one, making sure they're fully nourished in lots of other ways so they don't crave sugar, they don't need sugar, they're having meals. I'm very old-fashioned in that I'm a fan of kind of 3 solid meals of protein plus starch plus vegetable 3 times a day, and no snacking and only occasional desserts. And that alone can make a big difference. I'm going to present going to present some research. There's some research about zinc, the effectiveness of the nutritional supplement zinc, which is very safe and simple for acne, with the one little caveat that if you're thinking you're going to go rush off and get your girl some zinc, it's safe to try, but please just be aware that zinc on an empty stomach can make anyone feel kind of nauseated or sick to their stomach. So just triple check that. Just give it with food.
Go with the 3 meals.
Take it at the end of a meal.
Uh-huh.
And then I also, in my book, speak a bit about, for some people, that it's necessary to try some time away from or reduce level of cow's dairy for skin.
Oh, really?
So that's a little bit more, I guess just a little bit less conventional. But I argue in a few places in the book that cow's dairy is not the friendliest always to the women's hormonal system. I think there's a few mechanisms or reasons for that going on. Fortunately, usually goat and sheep dairy is fine. I also talk about something called A2 dairy, which I know is now, that's for the longest time, that was just an Australian or New Zealand thing, but I think now it's also available in the States. It's dairy from cows that are bred to not make something called A1 casein, which is an inflammatory protein. Yeah. So not all cows make that. So you can, there's fortunately becoming more dairy available that doesn't have that.
It doesn't create as much of the inflammatory or the mucusy.
Exactly.
Okay.
Yeah, exactly. Not mucus forming the way normal dairy can be.
Completely.
Yeah.
So as we're talking about this and we're saying, okay, we've got some different things that you've just provided for us as parents, or even as an individual, like, I do deal with acne. These are some steps I can take. You're also going to be covering, and we don't have time to get into it all today, but you're going to be covering perimenopause, menopause. Can you give us a little hint, or just a little snippet of what we might be covering with perimenopause and menopause? Yeah.
So I'll be honest, my section on perimenopause is going to be sort of the shorter part of the presentation.
Is that? Okay.
I have so many other things to say, but I am definitely going to mention it because I'm 49 now, so I can speak right from in the middle of what perimenopause is, which is about anywhere between 2 to 10 years leading up to menopause, leading up to the ending of periods. And it's actually, if there are going to be symptoms, and not all women have symptoms, but if there are going to be symptoms, it's often during that time that they arise. And that could be changes with mood, insomnia. And so I'm going to just offer a couple quick tips for that. Simple things, working mainly on the principle that the main feature of perimenopause is that we lose progesterone before we lose estrogen.
Okay.
Which is, I'll explain that a bit more on the day. But that's just an important thing to understand, that progesterone is kind of that. We all think about estrogen when we think about women's hormones, but progesterone is actually very important and actually a highly beneficial hormone, contrary to the conventional narrative about it, which we'll talk a little bit about.
We'll talk more about it at that time. So it starts to dive off, and then estrogen starts too, but we focus mostly on the estrogen and the ending of the cycle. So there's more to learn about that, and you'll touch a little bit on it. What other things can we look forward to hearing from you in the presentation?
Yep. So the first section, I've written the presentation now, most of it. So the first section is going to be my impassioned explanation about why ovulatory cycles are beneficial for bone and mood and building something called metabolic reserve, which we spoke a little bit about. Bone density is an example, but hormones are good for us in the long term in other ways, like they help to long term. Having natural menstrual cycles helps to prevent dementia, osteoporosis, cardiovascular disease, and breast cancer. So I'll talk about that a little bit. So that'll be the whole first section. And yes, some words about contraceptive drugs, similar to what I've said here, but a little bit in more detail, and providing some of that research. And then I'm going to talk about troubleshooting periods, so irregular periods, period pain, heavy periods, skin. I'll mention something called endometriosis briefly, which is quite a serious inflammatory disease that is often treated with the pill, and that's maybe one situation where the pill is unavoidable in some cases. So we'll talk about that. I'll provide a quick survey of non-hormonal methods of avoiding pregnancy, of which there's 5 or 6 at the moment. There should be more if scientists were doing their jobs. We have a few. Yeah, we do. And then I'll speak about I'll finish on perimenopause, and then finally finish with just a few simple takeaway tips of what this all means, including my favorite thing, which I end almost every interview and presentation with is just this, which is my message to women that, if you're sitting there thinking, okay, that's all well and good, but, my situation is different. My body's broken. I can't have natural cycles for whatever reason. I just want to say to you, based on my almost 25 years work with patients, to trust your body, that in the majority of cases, it is possible to have natural, close to symptom-free, symptomless periods. And that's our, I would argue that's our birthright. That's how the body works.
Yeah.
So trust your body.
Trust
it's easier
your
than
body.
you think. Yeah.
If people want to learn more about you or follow your blog or, get in contact with you, how can they do that?
Yeah, I'm easy to find. Everything is Lara Briden, LaraBriden. So that's my blog, larabriden.com. All of my social media, including Instagram, Twitter, and Facebook, is at Lara Briden.
Wonderful. So you're going to be here. I believe you're one of the first presenters for the Rocky Mountain Sex Summit. That is going to be November 16th.
Yes.
Morning.
Saturday.
We're going to have you.
Yes.
I'm super excited.
Yes. I'll be there.
The Rocky Mountain Sex Summit comes with continuing education units from ASEC, the American Association of Sexual Educators, Counselors, and Therapists, as well as the National Association of Social Workers. And if you just want to come without getting CEs, it even costs less to come and attend, to be able to see Lara. And we have 3 other presenters that are all going to be talking everything about menstruation, periods, and understanding this part of our body and in our life that hasn't really, as we've just spoken about today, is just kind of been taken for granted.
Yes.
So thank you so much for being with me, Lara. I am so excited to have you out here in November. I can't even wait.
Yeah. Thanks so much for the conversation. I look forward to meeting you.
I look forward to meeting you as well. We'll talk to you later.
Okay, bye.
This has been another episode of the Birds and Bees podcast. Thank you for tuning in. If you have any questions about the show, comments, or questions you would like addressed in another episode, please give us a call at 385-449-1818. Leave your voicemail and your question, or you can also email us at birdsandbeespodcast@gmail.com or visit us online at birdsandbeespodcast.com.